Imagine a condition with symptoms that present differently in each person who has it, and no currently approved lab test can definitively confirm the diagnosis. Imagine that the symptoms can flare up and then mysteriously disappear, including fatigue, low-grade fevers, joint pain, and mouth sores. All of these symptoms overlap with multiple other conditions, further complicating the diagnosis. Imagine that the best available method for diagnosing this ailment is a manual checklist of 11 criteria, and the patient suffers from at least 4. They can receive a diagnosis on a scale from definite, probable, or possible. What if I told you this condition is caused by an attack on the body by its own immune system? And the main way to treat this is by suppressing the immune system we depend on to help protect our bodies from infection. The course of this illness can range from mild to rapidly progressing to organ failure and death. This condition is real and has the most appropriate name, means the wolf in Latin. The condition is systemic lupus erythematosus, a condition which evades diagnosis and is difficult to treat. Lupus mainly affects women between the ages of 15 and 40, particularly women of color. For many busy young women with lupus, symptoms are often brushed off by family and friends, and unfortunately, sometimes by healthcare providers, who may just view the patient as being tired or overworked. Routine wellness labs, which serve as an alert system for other illnesses, provide no indication of lupus. Patients who persist and find someone to further investigate their symptoms may be misdiagnosed with a myriad of other conditions, sometimes resulting in unnecessary medications, treatments, and further suffering. Work is underway to better understand lupus. The trigger that causes the immune system to start attacking itself is not known, but scientists suspect it involves a combination of genetic and environmental factors. Research and awareness are making a difference. In the 1950s, the 5 and 10-year survival rate of lupus patients was less than 50%. Since then, the number has improved to over 90%. This increase in survival rate stems from improvements in our ability to diagnose lupus earlier and to provide better treatment once diagnosed. But we must do better. Early diagnosis of lupus requires patients and healthcare workers working together to persist in finding this wolf in sheep's clothing. If you or a loved one has concerns about lupus or other autoimmune conditions, talk with your doctor and see if a consultation with a rheumatologist would be beneficial.